especially
What are the other two or three things that you think that has elevated since you've
there's
introduced the electromagnetic?
two significant ones, and they both were in terrible car accidents. And one was in multiple car accidents, and it's my Angie. She was, and so there's always been this deep-seated pain in the iliopsoas area, complex triangle area there, and of course those are difficult areas to get to. And the first time, and so there's a constant deep nagging pain that changes, for instance, with the weather or what she's doing. The first time I used it with her, she was shocked at how deeply it went, how much of a relief she got. And it's great for areas like that and iliosacral areas where it's really just difficult to work these areas functionally and
Did you find that that shockwave was just too sensitive at that iliopsoas, or you had tried it and then you had plateaued?
It's a little more difficult with a radial shockwave. If it was a focus one, I could definitely do that.
Yeah.
Right? But with a radial, it's a little more difficult.
But that's a cost factor too, because those units are like 60K,
yeah,
like a Mercedes-Benz.
Yeah. I could have a Rolls Royce and never pay for it, or I could have a Chevy and help everybody, in one. And then when you bring in the PEMF machine in, combination of the two, when we do it on her hip, she starts walking normally again. The pain goes away for, long periods of time. And you're talking about somebody who's been in pain for 20 years with a chronic situation like that. So
from a now you've got patient experience, from a company experience with your interaction with me, how has that been for you in terms of how you would classify it?
It's great to be able to go directly to somebody, ask a question, and get an answer in a timely manner, and not have to wait months, weeks, sometimes it's been months, to get the support you need. I can dig up the research, all the research on my own. That's not hard. But when you and I are talking about hands-on experience, research is research. People are people. Experiences are experience.
Absolutely.
We've talked. One of the guys you interviewed, Dr. Pollack, wrote a tremendous book on PEMF that it's helping me to translate the information over. But people come in and say the research says this. I go, that's nice. That's a starting point. But you're not that person in that research. You're, I'm treating the person.
Everybody's got their own story and scenario. That's true.
Yeah, that's true. So I always treat the person, and I work in naturopathic clinics. I've worked in pain management clinics, and it's nice to have a treatment plan and all that. But on any given day, you got to throw the damn plan out and deal with where the person's at. Maybe, start over temporarily and come back up. So
you know what I call it? John Gruden has this phrase, situational football. We're doing that every day. You are adapting to the score in the game, the injuries, the off-field shenanigans, with and it's the same with off-field shenanigans with our patients.
Yes.
I went to, it was, Jazz Fest. I went and I got, I had a lot of alcohol, which doesn't help your inflammation level. And then I stumbled down this, so it's that kind of thing. Yeah.
Yeah. And it's always important. And you and I have talked about this before, managing people's expectation. These are great pieces of equipment. But I still have to get people to slow down, pay attention, do the self-care technique, do the treatment plan that we put together. Otherwise, we lose ground in between treatment and we can actually be back to zero or, ground zero again. Of course, we'll get off of it faster, but it's a synergistic and a cooperative.
It's a partnership, and I'm so glad you mentioned that because if I had a patient that just came in last week, and I looked at the shoes, and you could tie them up in a bow. So she's going out doing a couple tempo runs, and for me, in my mind, and you got to be very specific, I thought the tempo run she's going to go 1.5 miles, and I didn't key in because she hadn't brought in her running shoes that she's running. One of those racing flat, very flimsy shoes. After we're doing the treatment, and I didn't get as much relief, really. And I go, well, here's part of the answer right here. I don't care that your husband triathlete is running in these and he's solid. Your body can't do it. Just because he's doing it doesn't mean that that's the right fit for you. So definitely managing patients' expectation is the other side of that triangle of care.
Especially those who are getting older, to think their body should still be able to do the same thing it did 10 years ago, 15 years ago.
Yeah. Well, Craig, thank you so much for sharing your experiences. And, if people want to reach out to me, they can reach out directly. I answer my own emails. I don't have somebody else doing it. The best one to get me direct is abenpearl@gmail.com, or you can go to arlingtonfoot@gmail.com. And, I'm happy to share my experiences and refer people to new practitioners like you, not new practitioners, but new PEMF user practitioners like you, to give another side of how that experience is blended. And everybody's got their own clinic and how they're doing it. So you find your own path with it, but there's paths that we've both been on that will give you a base path. And then you can then do your variations from there.